Brilliant. So thank you everyone for joining and giving up your Sunday evening. It's 7 o'clock here in the UK. I know people have joined from around the world. So thank you so much. My name is Philip. I am the founder of Medimatch.io. We are a talent platform for healthcare professionals in the UK, working with healthcare providers, employers across the UK, across the country. Our mission is to empower healthcare professionals to do the job they love. We do this by creating technology that matches you with employers. We also do this by creating free tools to enable you to build your career. That may be through networking, through events like tonight, through social events, through meetups, through content. So our mission is to empower you to do the job you love. And tonight it gives me great pleasure in welcoming Ines Pereira, who is a clinical nurse specialist, who's going to give us a wonderful talk on the path to clinical nurse specialist and how to achieve your goals. If you do have any questions, we will do a Q&A at the end. So if you do have questions, please write them in the chat box on the bottom right, and I will ask the questions at the end. So please put your questions in the bottom right, and I will ask them in the Q&A at the end. So without further ado, over to you, Ines. I'm going to mute people, so over to you.
Hi, good evening, everyone. Can you hear me? Yeah?
Yes.
Okay. And you can see the presentation?
Yes.
So thank you so much for inviting me, Philip, to talk to our lovely audience this evening. As you know, and you can see from my name, I'm also not from the UK. So I'm originally from Portugal. So for those of you who've never heard about Portugal, sometimes people think we're part of Spain. So that's where we are in Europe, just at the end. And I'm originally from Lisbon. I wanted you to give an idea where I'm coming from for you to understand the differences, because I started working as a nurse in Portugal and then I moved to the UK. So one of the things I'm going to talk to you about is the difference between working in two different countries and how to adapt on working in two different countries. So I don't know, this is just for you to have an idea how we live in Lisbon. We have lovely beaches. We have a very nice old town, and we have what probably a lot of you have heard before, the Portuguese tart custard that a lot of people love, and I'm always bringing it back for my colleagues. So without any further ado, I'm going to talk to you about my career. So I've been a nurse for about 14 years. I started, as you can see on the left, we have also in Portugal private, but also have NHS. So the SNS is the equivalent of NHS in the UK. I worked there for 5 years. Then I moved to the UK in 2014. And I've been working in private healthcare most of my career here. But I've also done some shifts. As you know, there's an opportunity here to do bank shifts. So I've done some bank shifts in the NHS. So I have a little bit of an idea of how things work in both realities. As you can see in the middle, there's a Department of Health logo. That's when I moved abroad. So I've been in the UK for almost 9 years, but for a year I moved to Abu Dhabi, which was a completely different experience. And later on, if you would like to ask any questions about that, I'm happy to answer. But just for you to have an idea that I worked in different systems, I had to adapt to different realities, not only culturally, but also on the way that people work, because it's very, very different. This is just to give you a better overview. So for 5 years, when I was working in Portugal, my career started as an intensive care nurse. In Portugal, unfortunately, we don't have the same categories as you have here in the UK. So it's very difficult for you to progress in your career. So I was a as we can say, equivalent of as a staff nurse for 5 years, working in a neurosurgery and neurotrauma center. It was a very, very good experience. It gave me most of my knowledge on how to work as a nurse, how to work as a team, how to work with patients that are very sick patients, but also patients that when they are awake and they are moving through the process of moving back to the ward and then to go home, patients that need a lot of support. So this was a very good school, as I can say, not only in terms of learning about how to become a nurse and the scientific and biological side of things, but also on how to care for people, because that's what we are here for, to care for people. When I moved to the UK, I continued to work in intensive care, but I was given the opportunity here to progress in my career. So I started as a staff nurse, then I became a senior staff nurse, and then a sister in charge. So it's a completely different mindset. You have a lot of opportunities that you don't have in Portugal, and that's why I'm still here. So there's always a lot of opportunities for you. You have to try to be as informed as possible, talk to your colleagues, don't be fearful of what people will think, because if you don't try to get the answers that you need, then it's going to be more difficult for you to develop your skills and knowledge. So in saying that, I continued my career in intensive care, but I became, I'm not sure if in your countries you have something similar, but here in the UK, for specific areas, we have what we call link nurses. So for example, in my situation, I became a tissue viability link nurse, which is a wound care nurse. In other countries, they're called wound care nurses. But you will have link nurses for other areas. But in my case, I became a tissue viability link nurse, and that's when I realized that I will never stop being an intensive care nurse, but my passion for wound care developed when I moved into that role. Then the opportunity came for me to join the team, and that's when I started to learn more, develop my skills, develop my knowledge, and to become a tissue viability nurse specialist. Just a brief overview. So when I moved to Abu Dhabi, I was a nurse in charge in a general rehabilitation and COVID rehabilitation center. So I was still using a lot of my skills, both from intensive care and from wound care. But then when I returned to the UK, I decided to continue and to pursue the tissue viability career. Even within the tissue viability nurse specialist career, you have different levels where you can be working. So you can work in the community, you can work in a hospital setting, you can start as a tissue viability nurse and then progress to tissue viability nurse specialist. Some nurses, depending again on where you work, some nurses can be lead. So that's what I am at the moment. I'm one of the lead tissue viability nurse specialists. And some of the hospitals, again, depending on where you're going to work, some of the hospitals will have a head of department because the team is much bigger than in a smaller private hospital. So they will have the head of department for tissue viability. So as you can see, there's a lot of different opportunities. And as long as you're willing to make the effort and put the effort to learn more, there's always more and more opportunities. Even within this specialty as a tissue viability nurse, there's different areas. If you find that you have a specific passion, then you can develop further. For example, within the wound care setting, you will have plastics, you will have vascular, you will have pressure ulcer prevention. So again, as I said, in hospital or community. So there's different areas where you can continue to develop yourself and develop even when you're a specialist nurse. So one of the things that I've been asked to talk to you this evening is what were the challenges? So wherever you go, there's always going to be the initial language barrier challenge. It doesn't matter of course, if you're native and you know how to speak the language is much easier. But if you're from a different country, you will have to adapt to how people talk, because it's just not thinking, oh, I know how to speak a little bit of English, but it's how to express yourself, how to make you feel that people can hear what you're really saying. And if you've been in the UK before, you will see that depending on where you are in the UK, people will have different accents. And sometimes it was very difficult in the beginning to understand certain accents. So you have to train your ear to listen to different people talking. And again, in the UK, you have people from all over the world, which is very good because you will always find someone that you can relate to. You can always find someone that has been through the same barriers and through the same challenges that as you. But again, even just the talking, people will speak English, but they will be coming from different countries. So it's very difficult in the beginning to adapt to the different accents or ways to express yourself. The second thing is a cultural adaptation. So working in Portugal and working here is very different. In Portugal, you have what I can say a little bit more autonomy in the beginning. And here in the UK, you have to do a lot of more courses for you to be able to work more autonomously, which is not a bad thing, because at least we're making sure that we are striving for the best care for the patients. We're making sure that people are on top of their skills, on top of their knowledge, and people feel that they really need to know what they're doing. So it's a positive thing that I've encountered when working here in the UK. Apart from that, it's in terms of the cultural adaptation, one of the things that I can say that it was a challenge in the beginning is so if you are not sure or if you're not aware of expressions, for example, when people are talking to you, when patients are talking to you and they will say an expression and you don't know what it means. So that's one of the things that was a bit difficult in the beginning to adapt, or how people, even if you're talking about nursing in specific, the way that people will call a certain equipment, it's different. So in some areas here, people will call things by their brand name and not what they are. So in the beginning, they would ask me, can you bring me something? And I wouldn't know what they were talking about. So that was one of the challenges in the beginning, but easily everybody has been very helpful and very open to support me in the beginning when I was still struggling with what are you talking about. The other challenge is because from Portugal, I used to work in the equivalent of NHS. So when you move to private sector is another challenge, because people will have, the patients and your peers will have higher expectations. So I'm not saying that in NHS, the nurses are not doing what they're supposed to do, or they're not trained and they don't care about the patients. But in the private sector, you still have that extra component of the patients feel that they are entitled to obtain the care that the best care possible they can get, and as soon as possible. So there's a little bit of higher expectations from patients and also from your colleagues. So it's something that you also have to, that I had to adapt in the beginning. And then the other thing that was a challenge for me when I mentioned here nursing career, it's of course something positive, but in the beginning it was difficult for me to decide what to do. And that's, I think, one of the most difficult things when you come from a country where there's some specialities that you can choose, but the career itself is not, you cannot progress as much as here in the UK. So in the beginning, it's very difficult for you to choose what you want to do, because it's like a child in a candy shop. There's so many different opportunities. There's so many different things you can choose from, that becomes a little bit confusing, or you're tempted to try so many different things that you might lose the path that you want to follow. So that's was one of the challenges I faced when I joined. And so in saying that, how did I become a clinical nurse specialist? So in the UK, you have what we call a national career pathway. So you will start as a band 5, then you can go up to band 6, band 7, band 8. So there's very precise bands that you know what you're supposed to do, you know what are the goals, what are the objectives, what people are going to expect from you. And that's something that I think that it's very useful, because if you want to progress, you know exactly what you have to do. If you want to progress, it's not, of course, it's not set in stone, but I think it's something very positive that you will find here in the UK. is that you know exactly what you need to do to progress further in your career. Then, of course, you also have to look at where the trust where you're going to work or the hospital and try to find what are the opportunities. So depending on the teams that you will be working with, some teams are very prone to explain everything to new starters, to push people for them to develop themselves, but other teams, you will have to be the one showing that initiative. So it's making sure when you start in a new trust or a new hospital that you try to find out what are the different pathways as well to guide you on and try to find out exactly what you want to do. Because again, if you don't know what's out there, if you don't know what the opportunities are, you won't be able to choose. Or maybe you think you would like to do something and then you find out later on that there was something more interesting or that you felt that will resonate more with your personality. So it's very important for you to try to find out what are the career pathways where you're going to work. The other very important thing is networking. Again, depending on the area where you will be working, or if you are a general registered nurse, or if you're a clinical nurse specialist, for me, it was very important to go from ITU to wound care, to the wound care world, to try to find the right people to talk to. People that have been doing that job for a longer period of time, for many, many years, that can tell you, this is what you have to do to progress. This is what you have to do to succeed. So it's very, very important. And to continuously, oh, there's someone in the background, to continuously, don't lose that net. So people will always be pushing for each other and helping each other. So you really have to, it's a give and take situation. So people will help you in the beginning, but you have to also cater for their needs. But it's very, very important, because without this, I wouldn't be where I am at the moment. If I didn't network, if I didn't try to find how to improve, what courses did I need to do, and we're going to talk about that in a minute. If I didn't try to find that information, I will be lost, because I would never know what to do. So networking is very, very important. The other thing, as I've been saying, is being proactive, and don't be scared or afraid to ask. I think it's one of the things that I found here in the UK, that it's no one will tell you or try to hide from you the opportunities that exist. So as long as you are proactive and that you show that you're interested, people will be open to support you to develop in your career. And the other very important thing that I'm still doing at the moment, so I'm the lead tissue viability nurse at the moment, but I'm still pursuing my studies. So it's very, very important for you to always continue with education or training. Of course, I'm not saying that you will have to all go to the university and then do a PhD and then a master's and then a PhD, but it's making sure that you're up to the pace with the new guidelines, because that's something that is very important, and then people value here a lot in your work, is making sure, because can you imagine if you're looking after a patient and then they tell you, oh, have you heard about this guideline, or have you heard about this product, and then you don't know what it is. So then you might lose that connection with the patient and that trust relationship with the patient. So it's very important for you to continue to pursue. You don't have to go and do training all the time, but try to be informed, try to find evidence-based practice and where to find that information. So for example, for wound care, there's certain articles that I might use even to educate my nurses in the hospital. I know there's societies that I can be part of that will make me be aware of the latest guidelines or the latest guidance for a certain or specific subject. So that's something that it's very, very important, and that I think you should continuously pursue. It's education and training. In terms of education, so you will always have what we call here in the UK mandatory training. So it doesn't matter where you're going to work, what type of role you're going to have, there's always on induction training that you will have to do. So that training will be generic. For example, as a nurse, they want you to be able to do manual handling. They want for you to be able to know the infection control measures, for example. And then there's going to be also some mandatory training related to where you work. For example, if you work in intensive care, you will have to be able to show that you have competencies to look after a ventilated patient, for example. If in the wound care field, you will have to be assessed by someone else with more experience on to how to debride the wound, for example. So there's always mandatory training that you will have to do in order to showcase that you can work safely on that specific ward or on that specific role. Then apart from that, you will have, if you want to become a clinical nurse specialist, you'll have a clinical nurse specialist pathway. Again, this will vary between different trusts, between different hospitals, but when you start, you just have to ask them what is the pathway available. So depending again on your previous experience, you might have to do more or less courses. You might have to be signed off by someone competent on basic things. So there will always be a pathway that you have to follow in order to show your skills and your knowledge. But it's very, very important. It doesn't matter if you want to be a nurse specialist or what field would you like to pursue. You have to make sure that you have the right skills and the right knowledge to provide that care for the patient. Then there will always be governmental and educational agencies and university studies, as I mentioned before. Again, depending on the pathway that you would like to pursue, ask your colleagues, ask your senior colleagues, what are the opportunities? And if they don't know, just try again to be proactive. Try to find it through the societies that relate to your area of work. They will always have their pathways, and also all the universities in the UK that will be available for you to choose from. So for example, when I started, I just had to do a generic module at the university about tissue viability. And that was, let's say, the baseline that allowed me to work independently. After that, because again, depending on the type of patients you're going to be looking after, I still had to do some extra training because I wouldn't be able to provide debridement without a course. I wouldn't be able to apply compression bandaging without a specific course. So there was those 3 courses were key for me to be able to work independently. After that, how I do it, and that's the next point, to keep up with the new guidelines, to keep up with new products. It's very important for you to know the product. Sometimes you don't need a lot of products to achieve the same goal, but it's important for you to know if there's something out there that is better than the previous ones that you are used to. So that's why I wrote here conferences, webinars, other online resources. I think that's one of the positive things from COVID, that a lot of the companies and a lot of the journals, they created a lot of webinars, free webinars in the wound care world, but I know that I also follow some other specialties that I'm interested, for example, infection control. And there's a lot of free resources out there, a lot of journals that are free for you to read, and that's how you keep up to date with what's happening. In terms of conferences, it's very important to network, as I mentioned before. It's a place where you will be able to meet directly with other colleagues, other peers, and to share experiences with them, because you might be struggling or might having a challenge with a specific situation, a specific type of condition, or even processes in your hospital. And if you talk to your other peers, they might be able to help you, or they might say, in my hospital, this is what we do. Maybe you can try it as well. So it's, for me, going to conferences, attending conferences has been very, very important throughout my career, not only as an intensive care nurse, but when I started to pursue my clinical nurse specialist role. The other thing, that don't be afraid, as I said before, when I moved here, I was very shy. But if you don't try to network, if you don't put yourself out there, it's going to make it more difficult for you to know the right people that can support you to pursue your goals. So there's a lot of conferences that have what they call first-time speakers. So you have to send your abstract. They will support you. They will have someone to support you on how to do a presentation, or if you're just going to go for a poster presentation, it doesn't have to be a big presentation. They will support you with that. So it's just, again, making sure that you're up to date with what is out there in the specialty that you would like to choose or to pursue, and connect with people. People, they really want to help. When it says, especially when it says first time speakers, they're really, really there to help you. They're going to put you at ease, make sure that you have all the right support to be able to do your presentation for the first time. And once you start, then it's much, much easier to feel more at ease on how to present in front of more people. You can showcase your work, and that's something very important, because if we are doing very good work but we're keeping it to ourselves, then how can we support other colleagues? And you always have to think there's always going to be someone new that might feel that it's inspiring. So when I did my first presentation in a conference, the other two nurses, it was their first time as well, so we were able to support each other. And since then, they've been developing a lot of interesting projects, and if they don't share them with us, a lot of the ideas are really, really good, and you can use it in your own workplace. So I think it's very, very useful and important for you to try to attend conferences and try to be part of the team. So what to expect as a beginner? So I use these two pictures to showcase that it's not easy. There's going to be a lot of questions, and there's going to be a lot of doubt. So as it says here, you might feel lost. You might think, maybe I should be doing this or not. I will never be able to pursue this. Feeling that you don't trust yourself. So there's a lot of different feelings and situations that will put you to the test. But what I can say is, just try to surround yourself again with people that are willing to help you and that really, really want to help you, and try to focus on what you want. Because as I said, when I started, I was an intensive care nurse, and then I found my passion for wound care. So, but there's so many different areas that you can pursue even within wound care. So you have to try to make sure that you think about all the different options. Try to talk to people that have been doing the job, because sometimes you might think, oh, this sounds like a really nice role. But then when you talk to a nurse that has been doing it for a while, you might think, oh, maybe it was not exactly what I was expecting. So I think it's very important as a beginner for you not to doubt yourself, but also to try to reach out for people that have been doing the same role before. And then how can you pursue that role that you really want? So for me, this is a really good cycle that helps me to think what is the next step. So basically, you can start to observe and think, this is what I've been doing. What else what I would like to pursue? What else do I think I need to feel that I'm accomplishing what I want? Not only, I'm not saying only when you want to move to a different area or to develop within an area, but even to look after your patients. Is there any other skills or knowledge that I need to be able to provide the best care for the patients? Then you can go to analyze. So you try to gather as much information as possible about exactly what you would like to do. Then you should make a plan and make sure. I know that nowadays everybody's talking about making lists and thinking about, if you write it in a paper, it will happen. But what I mean is really make a plan. Where do I want to go and what do I want to achieve? Because if you have it in front of you and if you write it down, it's much easier for you to stay objective and don't get sidetracked when something happens and you're not expecting it to happen. And then implement your plan. Again, don't be afraid. Reach out for other people. Ask them how are they doing something that you would like to do similarly, or how to try. If you need more information, go back, analyze again. Is this really what I want to do? Plan it again and then implement. And then always reflect on what you're doing. So if you're trying to implement something new where you're working, you will always have to go back and reflect and evaluate. Was this worth it? Did this add anything to me professionally or to the patients, to the service that I'm providing to the patients? Is there anything else I have to change? So this is a cycle that I think it's very useful for you to think about when you want to pursue something new, or even within your role, if you want to continue to develop yourself. How am I going to do this? So think about what you're doing. What do you want to do? Analyze, try to gather as much information as possible, make a plan, try to follow that plan, and then reflect and evaluate. And these pictures is again, it's to try to showcase to you some of the difficulties and how do you choose where to go next. So the first one I really wanted to say to you is it takes time. But if you're really willing and if you put an effort, it can be faster than you think. And it's really trying to be aware of the opportunities, because you might meet, or you might even think nowadays, you know, a lot of people that after 10 years, 15 years, they're still doing the same thing. That's not a problem if that's what they want. But if you really want to pursue something in your career and if you want to develop yourself, just make sure that you are aware where to find those opportunities and be open to talk to people. Don't be afraid. That's something else that I've learned since I moved here to the UK is if someone reaches out to you, you don't have to say yes automatically. So it's very important for you to listen to what they have to offer, and then you will see, will that be a suitable role for me or not? And then you can make a decision. But if you are scared to talk to people, or if you're scared to take those opportunities, it's going to take longer for you to reach the stage or the place where you want to be. Second picture is, again, make sure that you have everything planned. So there's always going to be different ways how you can reach a position. For example, for a clinical nurse specialist, there's different ways. So you might be, I have some colleagues that they started to work on a ward, for example, a cardiac ward. Then again, they became the link nurse for or started to work a bit closer with the cardiac CNS. And then they started to learn. So what are the things that I have to know? What are the things that I have to do if in the future I would like to develop into that role? And write it down, make a plan. Make sure, again, it's realistic. When I came here, I never thought I could develop myself and be at the place where I am now. But you can't doubt yourself. Just focus on what you really want and make a plan. And even if it's baby steps, okay, so I'm in this stage, what I want to do. For example, I was a link nurse, and when the opportunity came, was only for a part-time role to join the tissue viability team. So what I've done was, okay, this might be my opportunity to move to an area or to work in an area that I enjoy. And you can always stay on your previous role as a bank, for example. So it's not that you have to give up completely what you're doing if you're not sure that you're going to like what you're going to do next. So that's what I did. I said, okay, I'm more than happy. That's perfect for me. So I did dual role for I think it was almost a year. So I was still working in ITU, but I was already part of the tissue viability team. And then I continuously developed myself. I did, as I mentioned before, the courses that I've done, working closely with consultants, learning as much as possible from other clinical nurse specialists, because as a clinical nurse specialist, you're working independently, but you have to work within a team. You won't be able to work by yourself. You will always need the physiotherapist, the occupational therapist, the pharmacist, the different consultants, even different clinical nurse specialists. Because, for example, in my pathway, wound care, you can find wounds anywhere that you can think of in the hospital. So a lot of the times I'll have to liaise, or even the patients are referred to me or to my team. They are referred by other clinical nurse specialists. So you might have a plastics clinical nurse specialist that would like your input as a tissue viability specialist, or vice versa. You might be seeing a patient, and then if you don't understand, for example, the procedure that they've done, you can reach out to your colleague, to the other clinical nurse specialists, for them to explain to you the procedure. And then you might say, okay, now I understand why this happened. Now I know how to create a plan. So it's really making sure that you have a plan on what you want to do next, but always network with the right people, and as much as possible, try to learn from different people. And the last picture, as I said before, there's different ways to approach where you want to go. You can always go back if you don't like it. And that's a very good thing as well, I can say, about the UK. If you're not happy, there's always a choice. And I think that's something that it's not that you should give up when you have a challenge or a barrier, but there's always other opportunities. So if that road that you took, the first road you took, is not the road that you want to continue, just, again, go back to that cycle, think about it, analyze what are the other options, why am I not happy here, and then you will find another another option. So that's what I really want people to understand is, if you want to pursue something, really put your heart into it. But then if you reach a point where this is not exactly what I want to do anymore, just focus again, refocus, and try to pursue what you really, really want. And I think that shows a lot when you're working with the patients and your colleagues. If you're really doing something that you enjoy doing, then you will be more successful and people will value your work, because as a nurse, you're there to look after the patients. You're not there just to fix something or to make sure that they have the right dressing for their wound. It's making sure that you are seeing the patient holistically, holistically, and making sure that you are providing the care for the patient. You're there for the patient. So that's very, very important. And that's me.
Brilliant. Thank you so much. We've had a few questions. So if you do have any questions still, please put them in the chat box on the bottom right-hand side. We're going to start asking the questions now. One question that's come in is, what made you decide to move to the UK and progress your career?
So that's a good question that I didn't explain. So basically it was in Portugal, and as I said before, there's only a few opportunities for you to progress. I think nowadays it's better, but when I used to work there a long time ago, it was very difficult for you to change a job if you wanted to find a new job. And it was also very difficult to progress, because you will have what we can say a staff nurse, and then you have what we call a team leader, but that nurse, it's not like the nurse in charge here. So you still have your patients, but because you are senior, you're supporting your colleagues, but you still have your patients. So it's not a role in itself. It's an add-on, let's say an add-on responsibility, but it's not a specific role. And then you will have like the ward manager and then the matron. So that it's very difficult, and people stay in the same job for a long time. So it's very difficult for you to progress. And there was a time that a lot of people from Portugal moved here. So on the news every day, they were talking about people moving and interviewing nurses that have moved to the UK and that were really happy with the opportunities. So that's when I started thinking about it. Then again, I searched for what job opportunities I could get here. Then I tried to get in contact with other nurses that were already working here to try to find out how difficult it was. At the time, it was easier before Brexit, though you needed to do less paperwork and it was an easier process. But that's why I moved. It was to really find a place where I feel that my work is valued and that I could progress, or if I didn't like it, there's other opportunities. So that's the main reason I moved here.
I'm on mute. Brilliant. As you've worked in private and NHS, what are the main differences?
That's a great question as well. So I think it depends on what you really want. I always tell everyone, if you are newly qualified, go to NHS, because the teams are bigger, there's more support, and you're going to learn. It's a faster pace, so it's in that sense it might be a bit more difficult to adapt, but it's a faster pace, and that's where you learn how to prioritize time management. You'll have multiple patients, so it's for me, I think it's a very good starting point for you to learn. And that's why I would say, to learn, it's better to go to NHS. I'm not saying that you can't learn in private sector, but I think you work with a bigger team. You have patients that are, a lot of the times, again, depending on where you work, for example, in ITU, you will have more exposure to patients that are acutely unwell much more often than when you work in private. In the private sector, I think, but again, that's my experience, it's easier to move up the ladder, because that's the other way around. The teams are smaller, so when there's an opportunity, it's easier for you to get that spot. So the main difference that I can see between myself and some of my friends that still work in the NHS is because every time, for example, you want to go on a course, NHS, they will still support you. The problem is you will have 30 or 40 people fighting for 2 spots. But if you're in private, the teams are smaller, so there's a higher chance for you to go on a course. And for you to progress, there's always specific courses that you have to attend. So it's much easier for you to progress if you're in private. That's one of the main differences. But I think both are good. Again, it depends on what you want.
Yeah. Next question. I think this is a really good question, actually, because I think a lot of people don't actually know kind of when is the right time to move to the next band. So the question is, how long does it take to move from one band to the next? I guess it's not really a specific amount of time.
There's no, it's impossible to tell you. So as I said before, it will depend on different factors. So it will depend on how big is the team. If you have a team that you have a lot of new starters, new people, usually new people that they are the ones who want to progress. So if you have a lot of people in your team that wants to progress, it's going to make it more difficult for you because there's more people, as I said, applying for the job, applying for the courses. So those are some of the factors. Then again, it's sometimes I think it's luck as well. It's not only you pursuing what you want and trying to find information, it's also a little bit of luck. Because if you're lucky to be in a team that it's really pushing and moving people forward, it's much more easier if you have the support of the senior team for you to know. Even people will tell you, I think you're ready to go to the next stage. You don't have to be the one thinking, oh, am I ready? Am I not? You can always get advice from them. But a lot of the times you will find very good teams that will tell you, I think you have the skills to progress for the next stage. Would you be interested? And then you can have conversation with them, see what else you need to do in order to progress. At the same time, is trying to find the opportunities. Sometimes the opportunity finds you, but sometimes you have to find the opportunities. Is being aware, for example, if you work in NHS, there's an online link that you can click on, and then there's all the jobs available. So if you're trying to think, I want to become a senior nurse, what do I need to do? You can use that as a reference because you just have to go try to find the job similar to what you do at the moment. Try to find the job description. They always have on the job advert, the job advert, they always have the job description. And that's a very good way for you. And that's how I did it before, to see, do I have all the qualities and everything that I need to progress to the next stage or not? I think that's one tip that I can give you. And that's what I've done before, to try to find out how to move to the next stage. But also, again, talk to your senior members of staff and to your colleagues, and people will be telling you, quite frankly, if they think that you're ready or not.
Yeah, that's a good answer. What are the names of the best courses you can recommend for a clinical nurse specialist? So I guess that's probably, a lot of it is specialty specific, but I guess what type of courses did you go on that have really helped you?
Yeah, so that will depend on the type. So again, as I said, I think if you're choosing a specific pathway to be a clinical nurse specialist, try to find the society. For example, for tissue viability, we have the Society of Tissue Viability. So I'm sure for other types of clinical nurse specialist roles, you will find a society that will equate the same thing. If you go on their website, then you will find a lot of information. They have webinars, they have again, conferences, how to attend, everything. So that's a very good place for you to find out, again, latest guidelines. And they also have courses. So that's a good way for you to find out. So when I started, I had no clue which universities will have courses related to tissue viability. So if you go to the society specific to your role, they might have there's always a part that talks about education and training, and they might give you the universities where you can pursue your studies. And again, make sure you understand, because in the UK there's different levels. So even if you're going to study in university, you might have different levels of study. So again, you have to try to get that information. Do you want to pursue a master's? You'll have to do all your modules at level 7. You just want to do an extra learning to get some extra knowledge and skills. You can do what they call continuous development, CPD. So again, try to talk to your colleagues or your senior members of staff and try to find out also what they've done before, or try to find out, for example, in your area. Another way for you to find out is where you live in the UK. try to find which universities. It takes a bit longer for you to go through that, but that's another way to get it. And that's what I've done before as well. I knew I needed to do a debridement course. So I searched for the universities in London. And then I searched for each one of them if there was one that was offering the debridement course. So there's different ways how you can access those courses and how to find out that information.
Great. A few more questions. What are your future career plans now you're a CNS? Where do you see yourself in 2 to 3 years' time? Ooh.
So I think that's a good question. And you don't know what you want all the time. So what I can say at the moment is I'm really happy on the role that I am. So my previous role was a tissue viability specialist. Then I became the lead. So at the moment, what I'm doing is trying to develop my leadership skills, trying to develop my skills on how to manage a team. So I think for me, and again, it depends on what is your drive. For me, things have to be interesting, exciting. There has to be a level of novelty. Because if it's always the same thing, I don't know if it's because I'm an intensive care nurse, but for me, if things are always the same, then it gets boring. And then that's when you're not gonna, I don't know. I think for me, I would lose a little bit of that spark. And I think that's what people will see in you when you're doing the job that you really like. So I don't know where I'm going to be in 2 to 3 years, if you want me to be honest. But I think I'm still developing myself. I'm still doing my master's. So it's something that will keep me going and developing my leadership skills, and also how to next step, for example, how to be more active, there's a lot of opportunities that you can become a member of the society. You can, for example, I'm part of some of international studies. I'm one of the key people that they will send some surveys and I will ask for them. So there's a lot of things that you can do and that you can be part of, different projects in your hospital or nationally. There's always a lot of opportunities for you to be part of projects. And I think that's, at the moment, that's where I see myself, is continuously developing my leadership skills, continuously develop my role. I'm not saying that you will have to move up the ladder continuously, as long as you're happy with what you're doing. There's, even within your role, there's different areas that you can develop.
Cool. Who do you have to go to start the clinical nurse specialist pathway? If in your workplace they don't give you the opportunity, how can you get into those studies?
Okay, so that's what I said. Sometimes it's luck. So again, depending on where you work, the pathways are, I know they're different from in NHS and private, because a lot of the times in private, the tissue viability team, for example, it's only one person, or you might have 2 people. So it's very different in NHS, because the trusts are bigger, they will cover community. And in hospital, you probably have 7 people that are part of the clinical nurse specialist team. So the pathways will be very different. I think the easiest way is to find out if there's already a specialist nurse in your hospital that does the role that you would like to do, is talk to them, because they will be able to tell you how did they reach that stage. Because again, depending on where you work, as a tissue viability nurse, for example, you might just need to do a general course, because the patients that you're going to see are more related to pressure ulcer prevention, for example, or basic wounds. But some trusts, for example, if you're working in a trust that has a lot of oncology patients, you might need to do extra courses, or you might need to develop other skills, because oncology wounds are very different from a pressure ulcer. So it's really trying to get that information. I think personally, if you find out that your colleagues are not being helpful, try to find another clinical nurse specialist. Even if it's not the area that you want to pursue, try to find someone else that is in that role, even if it's not the same pathway, because they will be able to tell you how to achieve that. And then you just have to find the right courses in your area. So that's another way, and I've done that before. It's reach out for people that are in the role, even if it's not the same pathway. They will be able to tell you, do we have a pathway in the hospital that you need to follow or not, and how you can pursue that role. But it's difficult if you're trying to get the information and people are not giving it to you. I think the other option is, as I said, try to search online, try to go to the Society of Nursing related to the area that you like to pursue. And they have a lot of information. Sometimes they even have people that will be, if you get their contact details, you can email them. I know, for example, in the wound care world, let's say, people are very happy to be supportive. I had people finding me on LinkedIn and just messaging me, where did you do your courses? Can you help me with this? Can you help me with that? So it's just really being open to try to ask other people and try to find those answers. But I know it might be difficult if you're in a hospital where people are not that supportive.
Great. Last couple of questions. I know we're running out of time. Someone asked, who regulates the role of clinical specialists in nursing? It appears this role is loosely applied across the NHS in the UK. Please tell us.
So again, unfortunately, it's not set in stone. So the basic, let's say, the basic competencies, skills, and knowledge that you need to have, they are the same across the board. The difference is, again, depending on the trusts, how much work you're going to do. For example, if you work in a place where it's just inpatients, you need a different set of skills than if you have to support the community team as well. So it's very difficult to say because, for example, tissue viability, as I said, we cover, if there's no CNS, for example, for a specific area, you will end up covering everything. So you'll be covering not just let's say, the regular wound care area, but you have to cover plastics, you have to cover vascular, you have to cover oncology. So there's a lot of different areas that you have to cover in terms of being a clinical nurse specialist. So it's difficult to say there's a pathway. So for example, where I work now, they created a booklet that has all the competencies that you need to have to be a clinical nurse specialist. So that's something you can always ask if in the trust where you're working, if they have a pathway or a booklet that will tell you exactly what you have to do. But I think in terms of, it will be impossible for me to tell you, even if it's as a tissue viability nurse, some of for example, the job description, it will vary because, for example, in private, we don't cover community. We have inpatients and outpatients, but we don't cover community. So our job description will be different from someone in NHS because a lot of the times the same team covers in hospital and community. So I understand and I can see how it might be confusing, but you really need to go with the rules and your trust values and rules and their mission. It's a lot of the things are based on RCN guidelines, but I understand there's not a clear pathway throughout the UK that will tell you if you want to be a clinical nurse specialist, this is what you have to do. If you want to become head of department of the specialist team, this is what you have to do. You're not going to find that. You really have to go through your trust and see what roles they have available and see the job descriptions.
Nice one. Okay. I think we're gonna ask the last question. This one's a long one, but I've kind of dissected it just to ask you one part of it, which I think would be useful. I guess this does, you can only really apply this to your hospital or hospitals you've worked at, but does the hospital sponsor you to have your tuition fees? Like, are the hospitals sponsoring you? Do they pay for your tuition? Or are you self-funding it?
So again, that will depend on where you're working. So, and it depends on what stage of let's say, the wider country is at the moment. So prior to COVID, let's say, and trust will have more money free to sponsor staff. When COVID came, the budgets were ran down with all the PPE, shortness of staff. They would, in NHS, they'll have to use a lot of agency staff as well. So I know at the moment, especially, for example, the course that I'm doing now, some people can only do one module per year. But that's the other thing. If it's really something that you really want, don't give up. If it might take you longer to finish the course, but don't give up. So each hospital has a budget for education. So again, try to be smart, talk to the education team at the beginning of the year and find out if they have a big budget, if they have a smaller budget, what kind of support they can give you. So some trusts will fund you completely, some trusts will fund you 50%. I've met some nurses that they had to pay 50%, but the hospital will only cover 50%. It really depends on where you work.
Cool. Good answer. I think, I mean, there was one about any tips for mental health nurses, but that's not really your area of expertise, is it? Could you give any?
Sorry, I didn't get the question.
Any tips for mental health nurses?
Tips.
But I guess that's not really your area.
No, but again, I was trying to think because I had to do something in psychology. So what I would say is try to find, because I'm sure there's like a group of
groups
people,
or
like
mentors and
mental health nurse support or something like that, where you can find the right people to guide you. I won't be able to guide you because I've never worked in mental health here in UK, but it's really trying to find, even if you go on Google, that's how I found out about the Society of Tissue Viability. I just wrote Society Wound Care, Society Tissue I tried different things and then I found it. So I'm sure if you write Society of Mental Health or Mental Health Society, you're going to find something, but make sure that you find the one that is related to nurses and not doctors, because it's going to be a bit more difficult for you to then find information that you want. But just Google it and try to find the society that relates to mental health nursing. And they always have education and training contacts. You can send them an email and ask the questions that you want to know. And they usually have people that just are there just to do that. So it's not that you're going to message them and you're going to wait them for a month for a reply. Usually it might take a week, but you will always get an answer. That's what my advice would be.
Yeah, brilliant. Great. Well, I know it's now coming up to 8 o'clock, and we've been on for an hour. So I just want to say a massive thank you, Ines, and a big round of applause. I know everyone's muted, but I'll do it as I'm unmuted. So thank you so much for giving up your time to put this wonderful presentation together, and for giving this wonderful speech and answering all the wonderful questions as well. So thank you everyone for participating and asking the questions. This has been recorded. There was a question about having access to the recording. I know people did join late, so we will put this on our YouTube channel within the next week. So you can subscribe to our channel on YouTube, which is manymatch.io, and see any past and future presentations. But without further ado, I just want to say a big thank you again. And of course, please check out manymatch.io. Please subscribe, please register on our website to be part of our growing community. We have thousands of clinical professionals on our platform now, and many hundreds of different healthcare providers up and down the country. So please do join us, and have a wonderful week ahead. So thank you very much. And that's it. We're finished. So I'm just going to end the recording and you can all leave the Zoom. So thank you.